So I wanted to talk about the things that I was diagnosed with before I actually was properly diagnosed as postmenopausal. And also to remind you that you're not crazy. I knew I wasn't crazy. I mean, I probably questioned it a couple times, but that's just part of being a woman. This video is also for men too, by the way. I think it's important that men learn about menopause because women make up over 50% of the population. So if we're not taken care of, then they're not taken care of. So you want happy women, right? You want to know what's going on. Maybe you can help them address their symptoms. Maybe you can help them self-advocate. Maybe you'll recognize something that's happening to them that they don't even know about because there's not much about it. Speaking from experience, I saw multiple specialists that didn't know what was wrong with me, but I knew what was wrong with me. I'm like, I am menopausal. I'm having hot flashes and I'm so dizzy. And from all the self-learning that I've done, that's common. Those are common symptoms of menopause. My estrogen is low. I had to self-advocate to ask my doctor to check my blood. And even then she's like, well, how about some evening primrose oil? Because if we can get rid of your hot flashes naturally, then we won't have to put you on the hormone therapy. Now, I love my doctor, okay? And I don't want to harp on doctors. There's some amazing doctors out there. Mine is incredible. She's awesome. She does like above and beyond. She's like the Mike Holmes of doctors, you know? But there's still this big fear about HRT and that it causes breast cancer, blood clots, and strokes, right? There is probably some truth to that, but it's very specific to people that aren't candidates for HRT. Obviously, I am not a medical professional and I'm not going to give medical advice. This is just my own experience as a woman, knowing that thousands of women are going through this and have gone through this and will go through this, including my 2 kids, both girls. And so I want to bring awareness to this because it's extremely frustrating when you are laying in the ER and people aren't listening to you and telling you that you're wrong and you're too young. You can't possibly be menopausal. So we're going to keep looking. I ended up in the ER because my vertigo was so bad I couldn't walk, and I ended up puking, and it was awful. They sent me home with antihistamines, steroids. This was after the evening primrose oil. Last summer, I was tested for ADHD. I was given ADHD meds because one of the symptoms of menopause is your brain just stops working. Like, I was doing a workshop, an acting workshop. Excuse me, I just need to catch my breath. I was doing an acting workshop and we were coming up with a play or whatever, and I all of a sudden couldn't comprehend what people were saying. I was ready to write down the scene that we were going to do, and people were saying things and I couldn't put it on paper. I just couldn't get from A to B. And it was the weirdest, scariest thing. I'm like, am I having a stroke or something? And I remember at the time I was listening to a lot of Mel Robbins and stuff like that, and ADHD was trending almost. And I was like, maybe I have ADHD. So I started going down the ADHD rabbit hole and talked to my doctor about it. And she's like, well, let's try. So I tried it. What is this? Methylphenidate hydrochloride. I don't know. It's one of the medicines that you can take if you have ADHD. It's not ADHD, it's menopause. So if you think you have ADHD and you get tested for ADHD and it's negative, maybe have your estrogen checked in case. So I did these, I did this, I did these. I went to go see a vertigo specialist. I saw an ENT. She told me to take CoQ10 enzymes. I was told that I have vestibular migraine. I don't know, it's just been crazy. Maybe you have a virus, maybe you have an infection, but everything that I was when I was tested for all those things came out negative. I went to go see a vertigo specialist who is a physiotherapist. She wanted me to do daily exercises. This is a laser, a headband laser that you wear in your head, and that I practice on the wall to address my vertigo. But that's not the problem. Finally, I went to go and see my OBGYN, and like I said in my previous video, we did 10 days of progesterone to see if I would get a period. Didn't happen. I am on day 3 since Saturday of trying or starting the estradiol patch. I will do a little video about that in a day or two when I have a little bit more feedback. But so far I'm feeling a lot better. I've been told that I look and seem a lot better. I do feel a lot better. My dizziness is much better. So we'll see how that goes. But yeah, I know other women have gone to see neurosurgeons. A lot of women get prescribed antidepressants. By the way, that is a very huge sign of menopause is depression, anxiety, heart palpitations, night sweats, hot flashes, mood swings, lack of period. Yeah, there's a lot of symptoms, but my goal is to bring a voice to menopause, bring awareness to menopause, start a menopause movement so that myself and women and men and like my daughters, for example, will be prepared and have the knowledge to know what to do and what the symptoms are telling you about what your body may or may not need, so that you're not suffering for 10 years and maybe getting into a worse health situation like brain, heart, bone health, all that kind of stuff, because estrogen is an anti-inflammatory and it stops you from laying down bone. It distresses your heart. Even things that are more, visual, like skin, your skin stops producing collagen as much. And if you care, I care. Aesthetically, how you look and how you feel in your body, like the weight gain that you might get, particularly around your midsection, which is dangerous. All these things, it just, like, you wake up one day and you just don't feel like yourself. And it's a nightmare when people don't give you the proper advice. If you're lucky enough, you'll go see a specialist like an OBGYN who actually does prescribe HRT. Then you're in good hands, right? And HRT is not for everybody, but they'll have options to help minimize your symptoms and help your lifestyle, right? Strength training, protein, all that kind of stuff. So yeah, I mean, my list of things that I've done, it's pretty small, but I mean, even thinking back like a year ago, I had 2 episodes of like a hot flush where all of a sudden I felt hot and turned visibly red from like my waist up, my back. I had patches of just red. Looked like I'd been in the sun for too long. My husband went and got like Benadryl or like some sort of like he thought I was having an allergic reaction. But looking back now, menopause. So your body is telling you and giving you signs. So listen to your body. If you have any suspicion that you might be menopausal, go get your labs done. Get your doctor to order your hormone levels, progesterone, testosterone, estrogen, and then once you get those back, and most of us now have a digital portal online where you can see your results. You can see that it's low. It'll say abnormal. And then that's when you can get referred to your OBGYN. So awesome. So the next time you see me, I will be teaching you a little bit about the estradiol patch, which has been pretty painless. It's been pretty cool experience. I'm very grateful to whoever invented it because it's very, very small and so easy for us to use. So, all right, that's it for now. Leave your comments, questions. I'm happy to answer them so that, we're not doing this alone. Have a good one.